Hello, good morning. Can everyone hear me? Yes. My name is Maday Infante. Welcome to the United Healthcare Individual and Family Plans rollout for Plan Year 2024. Your phones, your mics are muted during the presentation. I have started a message in the chat function. If you want to locate that at the bottom of your screen and hit chat, if you have any questions, place them in the chat and we will respond to them at the end of the presentation. So I can just keep rolling, but I will scroll back up. Also, what else did I want to say as a housekeeping item? You will get a copy of the presentation. You will have it via email and PDF form, and I will probably even enhance it because I've only included Florida and Texas here today, but I know that you all sell in different states. So there is more information, and I will go through it as we go through the presentation. So thank you again. We are delighted to return to Florida for a third year in a row, and we hope you are too. Our goal continues to be to set a new expectation of value for individuals and families by bringing reliable and affordable coverage to as many people as possible. But we can't do that without your help. So thank you. I appreciate you. Let's get started. Again, as I said, my name is Maday Infante. I am your agency manager for Florida. My counterpart is JP de la Cruz. He handles North Florida, Orlando, and other areas. So if you guys have agencies or locations in Orlando, he helps me out. We help each other out. I am in St. Petersburg, close to Tampa. I recently moved here in July. Something personal about me, my daughter just started college in the fall. She's a Gator. Very, very excited. Lots of changes for us. JP lives in Orlando. He's married. He has a beautiful boxer and he travels a lot. For any of those who just joined us, again, your mics are muted. Please locate that chat function so that you can type your questions in there and you will get a copy of the presentation later on today. Today, we're going to go over our growing footprint across the entire US, our provider network with key providers and hospital systems, our product offering with updates and enhancements, and last but not least, the enhancements in your Jarvis portal. In 2024, our footprint will grow from 90 markets in 19 states to 138 markets across 23 states. If we look back at 2021 for a minute, where we were only in 160 counties, it's incredible to me that we're going to be in over 1,000 counties across the US this year. In 2024, we're entering into South Carolina, New Mexico, New Jersey, and Wisconsin, and also large rural expansions in Texas, Florida, and other states. What's our network strategy? As I mentioned on the map slide, we're expanding into New Jersey, New Mexico, South Carolina, and Wisconsin. And within our existing states, we're expanding into 500 additional counties. Network is something we're continually working to improve. With this in mind, our team is focused on renegotiations, relying on the competitive rate info that's out there to achieve better pricing. We know there's more transparency now for the consumer, so if a deal can't be struck, we will consider an alternate provider system. And with that, there's also more opportunity for independent, standalone physician practices to join our network. Now, because United Healthcare has so many lines of business, I want to make sure I mention that when in doubt, if a provider is participating in our exchanges line of business, that you confirm on our website. Sometimes providers get confused. Yes, I take United Healthcare, but it might be a different line. It is one network for IFP. We don't have different networks. We just have one, but it is separate from the other lines like Medicare and commercial. We might have overlapping providers, but again, it's best to check our directory in Rally. So I've placed the link site and QR code on the slide for you. Again, you will receive a copy of the presentation. In Florida, we're growing our Cape Coral Fort Myers market. We entered this market in 2023 with much success in Lee County. So we're expanding into Glades and Hendry counties with Hendry General Hospital. In the Sarasota Bradenton market, we're adding DeSoto County. And we continue with HCA and I believe Sarasota Memorial, even though it's not on there, but I have to verify. In Miami-Dade, we haven't made any changes to our hospital network, but we did strengthen our relationship with the University of Miami Hospital and clinics. So that is worth mentioning. Moving on to the rest of the state, the big news is we're expanding into Tallahassee with 8 counties. They are Calhoun, Gadsden, Jefferson, Leon, Liberty, Madison, Taylor, and Wakula. I think that's how you pronounce it. The hospitals are HCA Capital Regional Medical Center in that area, Madison County Memorial, and as part of the Tallahassee Memorial Healthcare System, we have Calhoun Liberty and Doctors Memorial Hospital. We're also expanding into Marion County and Ocala with Advent Health Ocala, which is formerly known as Florida Hospital Ocala. Got a lot of asks for Marion County and the villages area. As a reminder, Florida is a gated HMO state, which means that referrals are needed to seek the specialist and other medical care. In Texas, I don't know anything about Texas except the fact that it is huge. So huge, they take up 4 slides where we only have two. So the big expansion is 158 additional counties in 2024 in Texas. Now, I can put you in touch with the agency manager that handles Texas for more detailed information. Again, I don't know much about Texas. I handle Florida, but I did want to highlight it and the fact that we have a big announcement. It came out a couple months ago. It's our partnership with Kelsey Siebold. I know that the agents are very excited about that. It is strictly in Houston in these counties. I believe that they have further coverage, but this is strictly for Houston in Brazoria, Fort Bend, Galveston, Harris, and Montgomery. Those are the clinics and the physicians right on the screen. I do know that they have some unique aspects to their network. I believe that there's no referrals needed to see Kelsey Siebold Clinic specialist if you're within those plans. Um, Spanish speaking, 24/7 appointment scheduling, and virtual primary care visits. Now, more about network. We heard you when you said we need more pharmacies. So, we're expanding our pharmacy network dramatically in 2024. This current year, our members only have low generic copays at Walgreens and OptumRx. In 2024, we're expanding the low generic copays to 5 times as many pharmacies, including Rite Aid, Kroger, Albertsons, and Walmart, plus independent pharmacies located in the directory. As a reminder, links to the pharmacies in our network can be located on the provider directory by scrolling down the page. At the top, you can search for PCPs, specialists, hospitals, but if you scroll down that same page, you will find all the links to our additional providers like pharmacy. Now let's dive into our products. This year, we continue with our family of products that you all know very well: Essential, Virtual First, Value, Advantage, and Required. Advantage, not to be confused with Medicare, this is strictly ACA. Advantage is simply one of our plan names. This year, we're excited to add a fifth product family named Copay Focus. Copay Focus plans are designed to bring more cost predictability and cost transparency for members. Zero deductible plans. Yes, you heard me correctly. Zero deductible, mostly copays. In 2023, zero deductible plans were only available in silver and gold. In 2024, they'll be offered across all three metal levels: bronze, silver, and gold. We are positioning this plan to compete with the zero deductible bronze plans that are very popular in our market. I will go into further detail about our national offerings and the steps to take advantage of each of these, but just at a high level, our 2024 benefit enhancements were based on what we heard from you and our consumers. So I've already shared about our new copay focus plans, and to keep beating the drum on how important the cost of valuable coverage is, we will have low, or in many cases, no cost virtual and primary care. And on most products, unlimited virtual urgent care. We have more office based labs that are $20 or less, office based at the provider office. Pharmacy being our most used benefit, we have $5 or less tier 2 generic medications. And we're offering zero copay on insulin and diabetes related labs on at least one plan per market. I'll highlight the one for Florida in just a minute. With our continued partnership with Walgreens, our members continue to have that 20% discount on over the counter items at Walgreens. And we're adding an in person fitness option to our Advantage plans. We'll talk more about that later. Lastly, we will continue to offer our $100 rewards for completing 5 easy steps, but we've bettered that a tiny bit this year. This year, we summarized our plans on this one sheet in addition to the longer, more detailed sheets. It basically has the same if the Advantage plans, the Silver Advantage plans, let's say we have two of them, but they have the same deductible and MOOP, you're only going to see it here once. It's just a summary, but we have three different versions of our benefit grids that you can pick your favorite. This is one version, some of the highlights of our plans. Silver Virtual First is our best top seller in Florida and Georgia and several other states. So we always highlight it. Talking about our bronze copay focus that we're so excited about, also highlighted here. On the next page, I love this gold copay focus plan. Don't know what the pricing is going to be yet, but I love that PCP, $5 office visit. Specialist is pretty low too. Now this FL0037 Silver Advantage, not sure exactly what it's going to be called, but it is the 0037. This is the one that has insulin benefits. I'll show you another slide on exactly what those tests are, and it's $0 insulin for all diabetes related items in the formulary. Now here's some base plans designs for Texas. As I mentioned, I don't have any plans to highlight. I'll try to do better next time, but I don't know much about Texas. But just so that you see, we do have some uniformity. Now, currently in your agent toolkit, I believe, or in the Knowledge Center in Jarvis, you already have some PDFs of our plan designs per state if you want to go in there and download them. Staying on benefits, as many of you know, we are one of the few carriers that have been offering adult vision and dental for some time. Well, we've also offered pediatric dental and vision embedded in our plans. Let's go over the differences to make sure that you know. Our embedded pediatric dental benefits are offered in all plans in every state except for Washington. There is no annual benefit maximum for pediatric, and for higher services, deductible and coinsurance apply. Orthodontia is covered except for Michigan, Mississippi, and Colorado. Now, adult dental is offered in all states except Colorado, Washington, New Jersey, and New Mexico. We do offer it in Florida and Texas in our Advantage Plus plans at the silver and gold medal levels. There is a $1,000 annual maximum for adult dental, no maximum for peds. The benefits do not apply toward the medical deductible for adults, and orthodontia is not included. Those are the big differences between adults and peds. On the rate sheets that I am mentioning to you in the toolkit, you will see there's a column for which are the plans that included, so you can easily identify them. Moving on to vision, our embedded pediatric vision benefits are offered in all plans in every state, no exceptions. The benefits are very similar in forms of coverage for adults and peds. For example, routine vision exams are free to both adults and pediatrics. Now, here's some differences. Pediatric vision does cover low vision testing at no charge and low vision therapy at deductible plus coinsurance. Adult vision does not. The other big difference is the cost share for frames and lenses. For pediatric vision, deductible and coinsurance apply. For adults, it is covered at the same limits as last year. No charge for routine exam, $25 copay for lenses, frames up to $130, and non-formulary contact lenses are covered up to $105. Now, when I mention deductible and coinsurance for pediatrics, I'm referring to the medical deductible. That is what's applied. And there is no waiting period for vision or dental, even for major services. With these plans that are embedded into our ACA plans, there is no waiting period. Diabetes care strategies. So in that Silver Advantage plan I mentioned to you in Florida, Florida 0037, each of the states has at least one plan that covers this. 6 key labs and screenings: diabetic retinal exam, kidney function test, hemoglobin A1C, metabolic panel, urinalysis, and lipid panels, all covered, $0, and all formulary insulin included on the drug list qualifies as $0. Virtual first plans, as I mentioned, continues to be our most popular plan in Florida, so we always highlight it to remind you of it. Offering 24 hours, 7 days a week access to quality care and same day responses, all for $0 copays. Now, it is worth mentioning that 75% of virtual first enrollees, 75%, stayed with their Galileo PCP assignment, which means that they must like it once they try it. As a reminder, members do have access to the same IFP network. Remember that one IFP network for everyone as other products. Now, they can go see a brick and mortar doctor, but it will be at a higher out of pocket cost. We are trying to incentivize the intended virtual care model. Remember, referrals are needed from the Galileo PCP. And very important in Florida, end to end Spanish speaking experience with Spanish speaking physicians. Other states that offer virtual first are Georgia, Texas, Michigan, Illinois, Virginia, Maryland, and Ohio. Our fitness benefit, we believe, well, at least that I do, that fitness is one of the prerequisites to happiness. Therefore, in addition to our digital fitness benefits we've offered in previous plan years, which is going to continue through OnePass, we are adding access to physical gyms on our Advantage plans through OnePass. Members can choose among a national network of name brand gyms in their neighborhoods and outside their neighborhoods. If they're traveling, they can go to a gym in another state as long as it's in the network. And it is free. Members can access and activate this benefit through their member portal by an access code. So remember, highlights. Our digital fitness benefit continues in every plan for every member. And our Advantage plans have physical gyms. As I mentioned, that $100 member incentive program continues for 2024 by completing 5 easy steps. We've enhanced the program for this year to be more rewarding by moving away from gift cards for specific stores. I don't know if you recall last year it was either Walmart or Amazon. Well, this year it's a Visa prepaid gift card that can be used anywhere. They need to log into their portal, register for their portal, sign up for text alerts, paperless, auto pay, and visit their PCP. We continue to provide that very popular 20% discount on thousands of eligible Walgreens branded health and wellness products. Over the counter products, Walgreens name brand, they will receive a separate card in the mail. Members receive a separate card in the mail for this. Finally, our complimentary AARP membership utilization surpassed our expectations. Consumers really are looking for savings and discounts, and we want to help them. So we're bringing it back for 2024. This is something that they access similar to OnePass on their portal, and it's available for all individual and family plan members, all plans. National marketing strategy. We'd like to give you a preview of what our national marketing will look like so you can quickly identify our brand. We continue to bring these messages to life for OEP and Plan Year 24 with this campaign, You Plus United Healthcare. We successfully launched it last year and it resonated strongly. So you will see enhanced content as we continue to learn and optimize this campaign this year. Something near and dear to my heart as a Hispanic is our Hispanic initiatives. We want to be the trendsetters in Hispanic initiatives because we recognize the magnitude of this population. Did you know that 46% of Plan Year 23, almost half of new ACA members were Hispanic? Not just United Healthcare, all carriers. It is the largest and fastest growing minority group, 63 million Hispanics, which is about 19% of the population. And it's expected to almost double to 111 million by 2060. And yet, they are the highest uninsured at 20%. So, from a marketing perspective, we know that translating the language going into Google Translate is just not enough. We want to be culturally relevant across our entire journey with images and messaging on our landing pages, our website, applications, and most importantly, with our support in Spanish. These are some of the marketing examples you'll be seeing as we continue to create awareness of our UHC IFP plan. To the left, you can see some of the platforms and our media partners that we will be using, like Facebook, Google, Fox, Tubi, Telemundo, I think I saw in there, Instagram. You will see us all over the place in Spanish and English. Now, hopefully, this isn't the first time you hear about our agent toolkit. This is where you, as agents, can customize our pre approved marketing materials to include your information and our UHC IFP plans. Agents that use the toolkit sell approximately 10% more, is what I've heard. Now, the toolkit is located in Jarvis. Marketing pieces are customizable flyers and brochures, social media ads, materials in Spanish, all kinds of stuff. Go in there, check it out. Now, aside from marketing pieces to help you gain more clients, we want to help you retain those members that you have with us. And we've created several tools in order to do that. For 2024, there are flyers you're able to use throughout the year to remind your clients of the benefits they have with United. The Welcome and What's Next flyer is available for you in the toolkit now. You can download it or print it at the point of sale or as a follow up. It includes a QR code to watch the onboarding videos. Now, in the first quarter, there's the 30, 60, and 90-day content for you to check on. At 30 days, we can help you remind your clients to set up their myuhc.com account. It has registration instructions and the 5 steps to earn their $100 incentive. At 60 and 90 days, we'll help you remind them to schedule a visit with their PCP, check out the benefits on OnePass. Did they receive that Walgreens discount card in the mail? We want to help you stay in touch with them. Now, operational enhancements to keep you informed of any changes in the market, enhancements to the portal, or just friendly reminders to do your certification. We created this IFP Connect newsletter that goes out every other Friday. If you have registered on our agent portal and you have an email address in there in your Jarvis portal, that is where the IFP Connect newsletter will go. So if you want to see our newsletter, log into Jarvis, make sure that your email is up to date, and that is where you want to receive it. We send it out in Spanish, Conexión IFP, and in English. Again, every other Friday. I believe it hits your inbox on Mondays. Something that came up in our IFP Connect newsletter that agents are asking for is text. So if you're interested in receiving text from us, text IFP to 90947. There's no spam. It's a maximum of 5 per month, and it's going to be important time sensitive messages. Now, it's not going to be something personalized to you with your member information, but it is going to be an alert, for example, that says, have you checked that late payment report lately? Make sure that none of your customers, none of your clients are falling through with payment, that type of thing. Speaking of Jarvis, new reporting, late payment. If you've logged into Jarvis in the last 2 months, you've probably seen the turning 26 and turning 65 reports. So we created these for you so that you are aware. Those of you that sell for Medicare, you've got clients that are turning 65. We will let you know, I believe it's 3 months before. Now, the newest addition is the late payment report. Easy access to those members you have that are in jeopardy of losing their plans, AKA you losing your commission. The late payment report will show you the balance due, the days remaining in the grace period, the contact information, and something really, really cool. Again, helping you stay connected with your members is the email function. Now, when you click on that email, it will pop open on your desktop, your email. From there, you can customize it. You can change the subject. Make sure that you read through that email if you use that function, because again, it's going to pick up the phone number that is in your Jarvis portal. If that phone number is one of an agency or an old number, that's where the member is going to call. So look through that email, customize it, change it, but it's just a tool to help you get started. Same thing with the turning 65 report. Very, very similar. Now we continue to make book of business enhancements. We know that our competitors are way ahead of us on this, but we do listen to you and your asks. You wanted to have visibility to the primary care provider and to be able to change that primary care for that member throughout the year. That's there. You wanted to see the member ID, be able to download it, send it out to them early in the year when they're making those doctor's appointments for the beginning of January and they haven't gotten their new ID card. Now you can do that. You can download it, you can send it to them. In addition, you can see all of the correspondence that we've sent to them. You can see the invoices, more and more info. We continue to enhance it. Also, on your landing page, you will be able to see those flags for late payment or turning 65, as well as in your book of business. Just a quick view of the member ID card. In 2024, you'll still have access to 2023 ID card in case there's anything, members lose it, need it for whatever reason, that will be in there for you. Now, if you're selling our plans off exchange, United Healthcare off exchange enrollments are available now this year in Health Sherpa for all states. Remember, our on exchange plans are exactly the same as off exchange, from benefits to price without subsidies, of course. No more PDFs. In the past, if you were selling off exchange for us, you had to print the forms, write them out, mail them, fax them. No more. Now you can do it electronically. And also separately, which is not included, the dental PPO plan that is ancillary, also available in Health Sherpa. Our PhD is there to help you. Now, you can always go to your upline at Benevest, and they have great relationships with our support departments, with our contracting department, with myself, and with others. But you can always go directly to PhD for quick questions about an application. My favorite way to contact PhD is via chat, logging in, clicking on chat, and chatting with them live. Now, if you've got a commissions question, honestly, I advise that you put that in an email because you can provide backup information, or at least, if it's more than one client, more than one member you're asking about. Also, let's say that you're not able to log in and you're not able to chat because you're having technical issues. Call them 866-235-4095. Save that number on your phone so that you can contact PhD if you're trying to log in. I will not be able to help you with anything technical. You would need to contact them. But they can help with many, many questions. They can escalate member related inquiries. They can escalate contracting questions. Use them. They're there for your support. Now, lastly, normally a person from the ancillary side goes through these slides. This year, we've actually added some ancillary products that has completely separate from ACA, completely separate from IFP, separate contracting. I just wanted to include them in our deck so that you know that those are available also for additional contracting. Reach out to Benevest for that. There's dental and vision, which are the most popular ones. Critical illness is a standalone plan now, accident, non insurance, hospital indemnity. Plenty of plans to complete your book, your portfolio, rather. Again, dental and vision, just some stats. All the ancillary solutions. This will be in your packet. And if part of an FMO, please reach out to them to obtain proper onboarding link under Benevest. And that concludes my slides, my deck presentation. So I do not see any questions in the chat. Let me see if let me try the Q&A. I have one question in the Q&A from Danny. Any plans in Florida that do not require referral? No. At this time, no, not for 2024. We are having discussions about separate networks and breaking up our plans, but right now, if a state is an HMO state, a gated state, it is that way for all plans. I'm watching the webinar on my cell, but I don't know. Okay, sorry, Delmi. The slide must have been a connectivity chat disabled. Are we getting a recording? Albert Sosa. I don't know if you're getting a recording. I do know that Benevest is recording it. You will definitely get a copy of the presentation via email. I don't know if someone from Benevest wants to jump in and answer that question about the recording.
Yes, we will be sending an email with a link with the recording.
There you go. Alrighty, I don't see any other questions. That is it for me. If you all don't have any other questions or Benevest tells me otherwise, then I will end the webinar now.
Okay, perfect. Thank you so much for this presentation.
Alrighty, thank you. Have a great day, everyone.
Same.
Bye-bye.
Remember that you can view this webinar again in the All Access Agent portal, logging in through insureuniversity.com. If you want to get contacted or you want to contact us in the future, our support information is here. Please write it down or take a screenshot. Again, thank you so much for joining us today on today's webinar. We're looking forward to see you again on future webinars.